I'm Dr. Pamela Maragliano-Muniz. This is my wonderful patient, Vicky. She's 52 years old. She has occlusal caries on numbers 14 and 15. And today we are going to excavate the caries and restore both teeth with OMNICHROMA FLOW. Let's get started. You ready, Vicky?
Yeah.
Teeth are numb?
Yeah.
Paula, you ready?
Ready.
Let's do it. Vicky, if you need a break, let me know. So we're going to clean out both teeth here. So the caries on number 15 undermined the transverse ridge. So we have kind of an occlusal preparation here. And on number 14, we've got two small occlusal preparations. One for the central pit and one for the distal pit. Okay, caries excavation is completed. The preparation is more or less completed, but for me, no prep is fully complete without a nice bevel on the enamel. So I like to bevel the enamel for a few reasons. Number one, it allows me to have a better bond to enamel because I'm going to bring my composite over the cavo-surface margin and onto that bevel. Also, it allows us to blend the composite really nicely onto the tooth surface. So we will end up with a really beautiful outcome. So I know these are tooth number 14 and 15, but I have to look at them for years to come. So I want them to be gorgeous. So let's bevel and we'll be ready to restore. I generally use a diamond burr to place my bevels onto my preparations. And I usually use either a fluted diamond, or in this case I'm using a football-shaped diamond, just because it's going to allow me better access to the preparation. So as long as it allows me access for my bevel, that was my instrument of choice. The bonding agent that we're planning to use is Universal Bond from Tokuyama Dental. I particularly like that bonding agent because it is compatible with every etch technique, selective, self, or total. I personally have a lot of enamel here on this preparation, so I'm going with the selective etch technique. Another great feature of Universal Bond is that it does not require a curing light. So if you've heard me lecture in the past, I'm always harping on the importance of an optimally functioning curing light, making sure your curing light is compatible with the restorative materials that you're trying to cure, and constantly monitoring your curing light, because just because it works today doesn't mean it's going to work tomorrow. And so make sure you monitor your curing light, or in this instance with this bonding agent, take it completely out of the equation. Let's rinse. Universal Bond is also given the name that it has because it is in fact a universal bond. You can use it for direct restorations, indirect restorations, on the restoration indirectly that you're going to that you're planning on bonding in place, and you don't need any additional primers or activators. So it's very, very easy for us to use. Just going to switch my light over. Another feature, I can go on and on about Universal Bond even by itself, but another great feature of it is you don't have to scrub it into your preparation the way some other bonding agents need to be. This bonding agent just really needs to be placed. It might appear like I'm scrubbing away, and I'm really not. I'm just ensuring that it has adapted to my entire preparation. I don't want to have any areas that haven't been properly bonded. So the whole bonding process takes approximately 25 seconds. You place your bond, which we've just done. Come on in with your air. I love this. My air syringe is simply just air, so there's no water that can escape here. And come in with a very light, gentle air pressure onto the tooth. Give that a good 10 seconds. And after about 10 seconds, come on in and depress your air water syringe or your air syringe a little bit more and have about a moderate amount of air drying the tooth. Not that it's necessarily drying the tooth, you just want any excess monomer to escape. And once you see that there's no bonding agent moving anywhere, you know that now it is time to start placing your restorative material. Thank you. Now, this tooth doesn't have a lot of overt discolorations. If I was removing an amalgam restoration, or if there was a lot of affected dentin after my preparation, I'd probably opt for OMNICHROMA blocker flow to help block out any discolorations that might be on the preparation. We don't have that here, so it's unnecessary. So I'm going to jump right to OMNICHROMA flow. When you extrude OMNICHROMA flow onto the tooth, one thing that's very helpful is that it looks rather white, and that's really intended to aid in visualization of the restorative material. When you extrude the material, make sure you don't lift the tip of the syringe too far off of the tooth, because you can incorporate air bubbles if you are to do so. So here we go. Number 14 is pretty well sealed. Go ahead and cure there, Polly. Again, check your curing light, but this material takes about 10 seconds to set with my curing light. Okay. Looks great. Okay, I'm going to come in here. This material is intended to also be placed incrementally. So I have about a good 3-4 millimeter prep on number 15 here. So I'm going to be placing this in a few increments. Go ahead, Polly. Another beautiful feature of this material is its low polymerization shrinkage. If you're using a material with low polymerization shrinkage, you're inherently using a material with low polymerization shrinkage stress, which means we can expect little to no post-op sensitivity after the restoration's been placed. So I find that if you work very quickly, you can create little cusps and anatomy in your restoration. But if you're a bit of a slowpoke like I am, you get to experience the excellent material's property to self-level itself. So I kind of like that, so that I know that my restoration is adapting really nicely to the tooth. All right, Polly. Once you get occlusion exactly where you want it, now it's time to polish. Just use your favorite polishing system, and you will find that you get a beautiful gloss on this restoration, and it has the ability to maintain its gloss over a long period of time. And last but not least, the final polish. Okay. Looks beautiful. Let's floss her teeth and we are all set. Beautiful. And a piece of gauze. So the entire restorations on numbers 14 and 15 were completed with OMNICHROMA FLOW. This material has the ability to be the only restorative material that you use for patients that present with anywhere from shade A1 through D4, and this can be used for class 1s, class 2s, class 3s and 4s. Generally class 3s and 4s, I'm going to couple it with OMNICHROMA blocker flow, but for a restoration like this, where these teeth, it was the first restoration that these teeth are enduring, OMNICHROMA FLOW is a perfect restorative material for this. So Vicki, thank you so much. You're a wonderful patient.
Thank you.